Care of the patient undergoing adipose-derived intramyocardial stem cell transplantation. A Competency for Registered Nurses by Lori Slanker for Excelsior College. My name is Lori Slanker. I am a registered nurse and I'm enrolled in the RN to MSN in Nursing Education program at Excelsior. This presentation is a review of my capstone project, and I hope you enjoy it. Introduction. The PRECISE trial by Parent et al., published in 2014, demonstrated that stem cells can be isolated from adipose tissue, processed, and reintroduced intramyocardially. The process can preserve and improve ventricular function, myocardial perfusion, ejection fraction, and exercise tolerance in patients with ischemic cardiomyopathy that have exhausted currently available medical and surgical treatments. The PRECISE trial is the basis for the procedure that we do here at my place of business, and that is why I've referenced it. The facility. The facility is a freestanding cell therapy center of excellence located in Freeport, Grand Bahama Island in the Bahamas. It is American-owned and administrated. We employ Bahamian, Jamaican, and American staff. The American staff are here on Bahamian work visas. We provide cell therapy under strict legislative guidelines and oversight by the Bahamas National Stem Cell Scientific and Ethics Committee. The practice problem is an inconsistency in training for registered nurses caring for patients undergoing intramyocardial stem cell transplantation. And the reason for the inconsistency is the facility has been open 26 months. So from the beginning, we've made some changes due to evidence-based literature coming out with improvements to our procedure. And so we need to now update our policies and procedures and training for the staff to reflect these changes. Some examples of the changes to the protocols. For instance, for the fat harvesting procedure, which is a liposuction procedure, we've changed from a 72-hour antibiotic perioperative regimen to a single dose of IV antibiotics on call to the operating theater. For the intramyocardial transplantation procedure, the main difference is that due to a development of a new C-shaped needle deployment system within the cardiac catheter, we're able to admit now candidates with thinner ventricular wall measurements to qualify for the procedure. The old needle came out, it came straight out of the catheter when it was deployed. This needle comes out and comes into a C shape. So you have less chance of perforating the myocardium, which makes the procedure safer for patients with thinner walls. The solution to the practice problem is the development and implementation of a self-directed online learning module that can be used for newly hired staff and also as yearly competency to update current best practices in the protocols. The learning outcomes for my project were based on Bloom's taxonomy, and learning outcome number 1 is to function as a leader and an educator within the interprofessional healthcare team. That falls under Bloom's taxonomy of application. Learning outcome number 2 is the utilization of technology in development of staff education projects for an interprofessional healthcare team. That falls under Bloom's taxonomy of knowledge. Learning outcome number 3 is to execute an appropriate and ethical assessment of adult learners in a professional setting. That falls under Bloom's taxonomy of evaluation. Continuing with learning outcomes, learning outcome number 4 is to provide useful and effective feedback to interprofessional learners to assist them in making sound clinical decisions. And that falls under Bloom's taxonomy of analysis. The final learning outcome, number 5, is to transition from an expert clinical nurse to a novice clinical nurse educator. And that falls under Bloom's taxonomy of synthesis. The ways that we will be evaluating the learning outcomes are listed below. Learning outcome 1 and 5 will be evaluated by the project mentor acknowledging leadership skills by conferring with administrators and the staff at the facility. My mentor has been available to me 24/7 throughout this whole project, even when we were both off island, and we were able to stay in contact via email and make sure that I was still on track with my project, and if I had any questions, she was available and responded rapidly. Evaluation of outcomes 2, 3, and 5 will be done by staff utilizing the learning management system, completing a brief survey at the conclusion of the module. The survey would be mandatory for the acknowledgement of completion of the module. The survey that I used was actually a part of the software and it was built in. The only problem that we incurred with the survey was that when the staff tried to fill it out online, it was unable to be completed online, so it was necessary for them to actually print it and fill it out by hand and turn it in. We believe that it is a problem due to the internet access being not what it should be here. We've had some technical difficulties with internet access during this project. Learning outcome number 4, the project mentor and administrative staff will provide comments and recommendations after the project presentation, acknowledging that the module is suitable for use as staff development tool and at the facility. And that was accomplished by multiple meetings with the chief nursing officer, my mentor, and myself. And that was prior to the implementation and development of the module, and also after the staff had taken the module. We had a meeting which included the staff, which was very informative. The stakeholders in the project. Patients and families were the primary stakeholders, and that's because successful outcomes are dependent upon engagement of patients as members of the care team. Inclusion of patients and families in care decisions improves quality. The facility, parent company, and shareholders are also stakeholders because successful treatment of patients moves company forward in its vision to become the leading provider of cell therapy in the world. Financial stability is tied to quality of care. The Commonwealth of the Bahamas is also a stakeholder in that we are the first company to be licensed in the Bahamas to perform cell therapy. The Bahamas' reputation as a credible location for consumers to seek out medical tourism is at stake. And medical tourism can potentially drive gross domestic product, attract foreign investment, and help to balance trade deficits in the archipelago of the Bahamas. The theoretical basis for the project, as far as nursing goes, was based on Benner's novice to expert theory. The novice nurse has no previous experience with content. The advanced beginner is capable of caring for a patient with support. A competent nurse is capable of caring for the patient independently. A proficient nurse has a more holistic view of the patient and the situation. And an expert nurse has far-reaching knowledge and can function as a mentor to novice nurses or any other level on that continuum. The theoretical basis as far as the educational component was based on Moore's transactional distance theory. And what that says is that Moore was saying the separation of instructors and learners in distance education could lead to misunderstandings and communication issues. Larkin and Jameson wrote a paper, and they actually used Moore's transactional distance theory to verify the use of Web 2.0 technologies, such as Voki and Glogster, which were utilized in the module. And what they found was that these interactive technologies do present information and enhance the online learning experience, which decreases that separation of the instructor and the learner. Project planning. The first thing we did was set up a meeting with myself, my mentor, and the chief nursing officer. We went over what the recommendations were, what she, as the chief nursing officer, would like to see included in the module, and we set up a plan for that. Next, we had a meeting with the nursing staff itself. We're a very small staff. We employed 4 RNs. So it was a very productive meeting, and getting the nurses' input on what they would like to see in the module. We were fortunate as new nurses. We all have critical care backgrounds, but none of us had any cell therapy experience. Fortunately, the physicians who are on our board have vast experience with cell therapy, and we were fortunate to get it straight from the horse's mouth, as they say. We had presentations from them, and any questions were happily answered. All of them really enjoy teaching, and so that's where we came across our background. But now that we are expanding and thinking about adding on staff, we can't just bring these experts in. So we have to take that knowledge and put it into a plan for new hires. And that was mainly what came out of the meeting with the nurses. So we've reviewed the current policies and procedures and updated them with what we are doing now. I did a review of literature. Then I created test blueprints for a pre-test and a post-test, and those were to identify that learning had occurred. I created core questions, 5 core questions that would appear on the pre-test and the post-test, and then I created the other questions around that. I chose the web-based learning module, which was WebQuest. I had worked with it before and found it easy, pretty user-friendly, and also easy to use as the learner going through the module. I then created a Voki, which I used throughout the WebQuest on every page to give instruction, and that was accompanied by a transcript on each page of the instructions. I then developed the learning module and presented the completed module for review to my mentor and the chief nursing officer. We made some revisions, had another meeting, and decided on a date for rollout. The objectives of the project as far as the learner is to identify sources of stem cells and the mechanism of action of mesenchymal cells, to relate the criteria to include and exclude a candidate for cell therapy per facility policy, and to confirm postoperative cardiac catheterization nursing care elements to include flat time, pulse checks, monitoring, and splinting of the groin site. In order to evaluate the objectives, knowledge of project objectives was evaluated by successful completion of a multiple choice exam with a minimum score of 80%. 75% of RN staff was expected to successfully complete the module on the first attempt. The project implementation. So a link to the learning module was sent out to the RN staff via email. All staff members completed the module promptly and returned the evaluation forms as requested. I must say, within 48 hours, I had them all completed and evaluated. The staff was very excited about this project. I've included a link to the module should you want to check it out. You can copy and paste. The reviews were excellent across the board. The RNs enjoyed the self-directed online environment and found it easy to navigate. The interactive Glogster posters as well as a Powtoon video were mentioned as particularly entertaining and informative. Some of the comments were, "I wish I had had this when I started," "very professional," and "well presented." The results of the project were 3 RN staff members participated in the learning module, and that is 75% of our staff. 2 RNs missed one of the 5 core questions on the multiple choice pretest. They did not miss the same question, so there was no question about the question itself. All 3 RNs received a score of 100% on the first attempt of the post-test, which met the requirement for 80% in order to pass. The average time spent on the learning module was 48 minutes, which was well within the 90 minutes that I had as the allowable time frame. New hires, I'm sure, would require more time as a lot of the information would really be new to them. So in conclusion, the project was a success. It fulfilled the needs of the organization and updated the training. It promoted safety and continuous improvement in the facility. It reflected patient-centered, evidence-based nursing care, and it allowed me to function as a leader and change agent within the organization, which increased my movement towards an advanced beginner nurse educator. And the references are as follows. I appreciate your time in listening to the presentation and wish you all well. Thank you.